Well, good morning, all. Thank you for coming to the Disability Awareness and Etiquette training. This was the third session and our final session. So I want to thank you and welcome you, and let's get started. So the last couple of days, we talked about a few different things regarding disability. So first we defined disabilities. We talked about the different types of disabilities. Then we talked about inclusion and what that meant. And in the second session, we talked about the barriers that could inhibit full inclusion of people with disabilities. And we talked about appropriate, respectful language. So today we're going to talk about disability etiquette. That's it. So we're going to get started. So etiquette. It's just, etiquette basically is the polite and proper way to do things, not necessarily a politically correct kind of thing, but it's more of respectful sort of things. So we are going to divide the etiquette into the same types of disabilities, the categories that we talked about before: physical, visual, hearing, mental health, intellectual, and learning. So first we'll talk about some general principles regarding disability etiquette. So you want to treat people, if people are you're going to treat people with disabilities as people first, then you want to treat them as you would anybody else, any other person. You know, you want to shake their hand, say hello, the basic things that you would greet anybody else. You want to treat someone with a disability the same exact way, because they are people first. Just since they have a disability doesn't mean that we're not people. Okay, be sensitive about physical contact. There are people who have tactile sensitive sort of disabilities, or they're more standoffish. Some people look at it as standoffish, but they don't like to have physical contact. They don't like to be too close. So just be aware, as anybody else, just people have different boundaries. So just being sensitive and aware of how you contact people, their personal space that you give people. It's just general common sense, but with people with disabilities, it might seem like it's a little bit more common, or a little bit more, to be a little bit more sensitive about those areas. So you want to identify yourself, especially when you're talking to a blind or visually impaired person. You walk up and you say, hey, it's so-and-so, blah, 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 and then they'll know. We'll talk a little bit about blindness later, but I just wanted to kind of put that in there. And also be patient, because oftentimes people with disabilities might do something a little bit slower or a little bit different. So just be patient in what's going on. They may have a hard time speaking, so you want to allow people that time to say what they need to say. Allow people to take a long time to complete a task or something. So just being very patient is something that really it helps a lot. Okay, ask before you help somebody. So if you see somebody struggling to get to a certain place, or put something away, or complete a certain task, if you think they're struggling, ask them if they need help. And the thing is, if they say no, leave it at that. It's okay, because a lot of times people with disabilities want to be independent. So even if it takes them longer, or it's more difficult physically to do something, it's much better to do it ourselves rather than have somebody do it for us. But also be available to help if it's needed. Let them know, look, okay, that's great, but if you find that you need help, I'll be available, or will be available to help you whenever you need it. And then leave it. Let the person be independent. Let the person do what they want to do according to their independence and their abilities. And don't make assumptions. Just remember that people are people, and people do things differently. People act differently. People, just don't assume something just because. All right. Let me do something real quick here. There we go. All right. So, oops. And then if somebody does ask you for help, don't give them an attitude like, oh, I really have to help them. Like, oh, yeah, I suppose I can help you. No, be gracious and kind, and help somebody with the right heart and the right spirit, and be genuinely happy about helping somebody. So be gracious, be kind. Because if you're not kind and not gracious, chances are they won't come back to your establishment, because feel like they're being treated rudely and they're not getting the assistance that they need. All right, so let's talk about physical disabilities. Someone who is a wheelchair user and you're trying to talk to someone, after a few minutes of trying to talk to somebody, let's say you just say hello and you're going to be going on, that's fine. But if you're going to talk to somebody for more than a minute or so, find a seat and sit down and be at eye level so that they don't have to wedge their neck to look up at you. If you can only imagine sitting in a wheelchair and having a long conversation, it can be very painful after a while. So just be kind and considerate and just sit at eye level and speak directly to the person. Oftentimes what happens is somebody has a companion or a friend or someone pushing their wheelchair or someone interpreting for them. And the tendency is to speak to the helper, not directly to the person themselves. So, I mean, I have an example of that when I was in a wheelchair for a short time after being hit by a car. My daughter and I went to the grocery store, got what we had to get. I was in the wheelchair. She was helping me. And so we were in line and a lady asked my daughter about what happened to me, why I was in a wheelchair. So my daughter, knowing the whole situation, said, well, why don't you ask her? She can answer it. So that's kind of the idea that I'm trying to say, that when you see someone with a helper, don't automatically assume that that person cannot respond and that they're not intelligent enough to respond to whatever your question happens to be. So, that lady did actually talk to me and realized that, I was, just because I was in a wheelchair didn't mean I could answer whatever questions that she had, which I didn't mind answering them. So just remember, keep that in mind, because that's something that's kind of a tendency, but if you really focus on it, it makes more sense to speak directly to the person you want to talk to. And speak normally and clearly. People, like even people who are hard of hearing and they read lips, they don't, if you exaggerate, you do crazy things that are different than your normal clear voice, they won't be able to read the lips, they won't be able to hear well. So like even when we talked about too, the different, we talked about how sometimes people who speak to someone who's blind, they raise their voice and yell. That has nothing to do with the other. So just remember to speak normally and clearly as you would anybody else. Okay, so blind people oftentimes use a sighted guide. So that could be anybody who knows what they're doing. That could be someone like just to get around different areas. In the sighted guide, you want to make sure that you ask somebody if they need assistance or if they'd like to be guided, and you put your elbow out beside them. They will hold on to your elbow, and the elbow helps to give them some space between you, like be a little bit behind you, but also realize where you're walking. If you step up, if you turn, whatever. As a sighted guide, you have to make sure that you are giving the person that you're guiding enough space and direction. But like I said, don't just grab the person's hand and say, okay, we're over here. Allow them to hold your elbow, and then it's easier to get where you need to go using that method. And be specific about your directions. If you say, if they ask you a question, where is the information desk? Oh, it's over there. Well, a blind person won't know where over there is. So you want to say it's to your left, it's directly to your left. If you take a sharp left and go straight ahead, it'll be there. Or it's at your 2 o'clock, over the, turn to your 2 o'clock, go straight ahead. Or whatever the directions are, give specific directions where the person needs to go, rather than over there. And if they need assistance, then ask, would you like me to assist you? They'll say yes or no. And that's the same thing. Okay, they say no, fine, allow them to find it according to your directions. And when you enter a group or you enter someplace and you're going to be speaking with the blind person, or, few people are there and you come in, you want to announce yourself. You say, hey, oh, it's Debbie. I just got here. Depending upon the situation, you'll know the right words to say, but make sure that the person who's blind knows that you've just gotten there, you've just arrived. And the same thing if you're leaving. Hey, I gotta go now. We'll talk to you later, whatever. So that the person knows you're no longer there and they're not talking to somebody who's not there. for a deaf and hard of hearing population, they want to attract the person's attention before you try to communicate. If you just start talking, they're not going to know that you're talking to them. They're not going to know, and especially if you're behind and somebody's deaf, they're not going to know you're saying anything. So kind of wave the hand in front, be careful about the touching thing, like we talked about before, but there's ways to get people's attention that do not involve touching people or scaring people. So you want to give them a wave, and then you can communicate better that way. Face the individual and speak normally. We talked about that before. You don't need to slow down your speech. You don't need to change the way you normally talk. And the person will let you know if they're not able to understand you, and then you can adjust things that way. But you just want to speak normally to the person, and don't speak to the interpreter. Like we talked about before, speak directly to the person. It makes a big difference, and you want to be respectful of that person and not think they're not intelligent enough or able enough to answer your questions or talk to you or carry on a conversation. So mental health disabilities, there's a lot of talk about mental health and disability, if it is a disability, and just a lot of things. And people don't always think of mental health as being a disability, like if there's mental health issues. So if somebody is having an issue, or the person that they do have some mental health issues, there's some kind of things that you can do to help them along the way, help them to be included, to get that sense of belonging. You want to make sure that the environment that you're in is as stress-free as possible, especially if the person has some kind of an issue, or if the person is having an episode. You want to try to get into an environment that is calm, quiet, not crazy. You want to be supportive of whatever that person is needing, whatever that person is going through at the time, and ask how you can help. The same thing with everybody else, everything else. Ask first, ask how you can help, and listen, and do what they say that you can do to help. Someone with mental health issues must say, nothing, just leave me here for a minute. Or they may say, can you call somebody? Can you call my sister? Or can you call my mom? Or whatever it is, that person, they'll know what they need. And then if it gets to a point where they're not responding, they're really having a hard time, have a crisis number on hand. If you, even if you don't know that you're in a business, you don't know a person has disabilities, all of a sudden you just want to be prepared. So have a crisis number just in case, for yourself, for your customers, just in case you need that. Sometimes things will happen that, people are unexpected. People who have mental health disabilities may not realize something's going to happen. And so you want to be prepared ahead of time as a business owner, as a church like a pastor or something. You want to have these kind of things available anyway, just in case, because you just never know. Okay. All right. So person with intellectual disabilities, there's somebody that is unable to learn beyond a certain point. So what you want to do is just use simple sentences. Don't get into these long things. Like me, I can talk forever and have these long sentences. So I know I need to be simpler when I'm speaking to somebody who has some kind of an intellectual disability. Be clear and concise on your directions. You don't have to go into all these details. You can say, put the green container on the top shelf. Whatever it is simple, easy to understand. Be generous and appropriate with compliments. Don't compliment somebody just because. If someone does something you appreciate, say thank you. If something that a person accomplishes that they really struggle, but they went through and they did it, just be gracious, just be kind, because people in general respond much more to compliments than they do to criticism. So just keep that in mind, especially when you're talking to somebody with an intellectual disability. So be non-judgmental and patient. So maybe there's somebody who's trying to do something and it's taking a long time, or they're doing it in a different way, or they're supposed to, let's say, even just going to the bathroom and washing their hands or something. To allow them the time they need, give direction as needed, and don't overpower people, don't judge them, just like they're stupid, they can't do anything. That's mean and awful. You want to be kind and generous. There are some people who may not be able to respond to you, people who have intellectual disabilities. So you just want to know that, talk to them the same thing like anybody, and treat adults as adults and children as children. Oftentimes when someone has an intellectual disability, the tendency is to treat them as a child, because intellectually they may be there, but if it's an adult, you want to treat that person as an adult, speak to them as an adult, not as a child. And if you want to establish some relationships and help the person feel comfortable with you, you want to find common areas that you like. Maybe it's someone in your church and you want to, find things that you both like together. Maybe you both like puzzles, or maybe you both like singing or something like that. Find things that you have in common, and that will help to bond a relationship with somebody. So learning disabilities is another one of those hidden disabilities that people don't actually realize oftentimes that a person has a learning disability. It's not obvious for most of the time. So what you want to do when you're teaching a class, and just to make sure that you're taking care of everybody in the class. There may be people with learning disabilities that you don't realize. So you want to use various methods to teach whatever concept you're teaching. Or even within the workplace, you want to find different ways for people to accomplish their jobs, different methods, different ways, and allow people to do things in different ways. You want to minimize distraction. So you're in the classroom, you have certain class, you don't want to have people running in and out, crazy noise, extra radio on. It makes it difficult for many people to concentrate on what you really want to teach them, or what's really going on. You want to, even in a work environment, you want to make sure that the distractions are minimal so that people can actually do their job. So there's a concept that it actually started, I believe, in the college, secondary school sort of atmosphere. It's called Universal Design for Learning. And there's some principles involved in that have to do with using multiple methods to teach something, allowing for different people's learning styles, learning paces, things like that. So it's something to consider when whether you're in a work environment, a church environment, or teaching a college class. You want to keep teaching any class. You want to make sure that you use enough methods that children or adults with different learning styles will be able to get the concept. And be flexible, because some students may be good at testing. Some may be good at written, may have a learning disability that prevents them from taking a written test successfully. So you may want to provide an option for oral testing, or provide untimed testing, things that people may need. You want to make sure that you're accommodating as many students as you can, and even if you don't know if they have a learning disability, do your best to accommodate. And if someone does, they'll hopefully come to you. And if you're teaching a class, especially with adults, and you may say, look, if there's something that you're having a hard time getting, or if there's something that you need me to do for you, just let me know after class and I will help you in whatever way I can. So that allows people the freedom to come to you and say, hey, I can't do written tests. Can we do an oral? So you want to put that out there as a teacher or an instructor, or even someone organizing some kind of a convention. You want to put that out there so that people know they have options. Okay. So on the next slide, I have examples of someone with a learning disability, with dyslexia. Dyslexia is pretty common, and you may not realize people have it. And so there's different ways that people see writing or see things. And this slide shows different ways. One is it's like they see things like circling around, the letters and the whole text circling around. They see it all blurry and messed up, and you can't make out the letters or the words. So may see like the different spaces between words are all mixed up. Sometimes there's a space in the wrong place, and this is what their brain sees. It's not like people are just ignoring what's on the page. They're really trying to read it, but this is what their brain sees. You would see words spelled wrong. It's very easy for someone with dyslexia to spell words wrong. Their spelling is because they don't see it the same way that people who don't have dyslexia see it. They also may see all the words mushed together. So there's different things. This is just one example of a learning disability that I thought is very common. And just because someone can't read doesn't mean that they can't read. In other words, like if if they have dyslexia, there's methods that can be taught, or you can allow people oral stuff, listening to books, listening to instructions instead of having to read it, taking oral tests instead of written tests, things of that nature that would help someone with a disability, with a dyslexia. That's just an example of what kind of things that you may come across that you don't realize it until later on, or somebody comes to you and says this. At least you'll have an idea, that this is happening. So that is the end of the disability etiquette stuff. Now, those of you who have registered for this webinar series will get a handout which goes into more detail about etiquette, and that may help you even more. So now what we went through in the entire series was, first we talked about disabilities and inclusion. What does disability mean? What kind of types of the disability? What is inclusion and what does that look like? How do we get there? We get there by planning. Then we talked about barriers to inclusion. And the reason we talk about barriers, because if we know the barriers, we can do our best to eliminate them so that we can be more inclusive. We talked about appropriate language, respectful and decent language. People with disabilities are people first. And then today we talked about disability etiquette, taking different types of disabilities and giving a few pointers on appropriate ways to interact with people with disabilities. So hopefully you did learn all that. So now the general concept that we want to get is people with disabilities are people first. So if you think about that concept and you think about the person first and the disability later, it helps to realize people's abilities. It helps them develop relationships. It just helps overall to promote and not just promote, but be more inclusive in general. So you're probably thinking about, okay, what is next? Okay. So now let's say that you want to work on inclusion. Okay. So there are things that we can do to help you get to that point, get to what you want. First of all, the next thing you want to have a vision. So maybe you don't know what that inclusion looks like. You don't know what it wants. Now we'll help you come up with the vision that you want, but it's what you want, what your company wants. You as an individual, you can say to yourself, okay, I know I want to be more respectful. I want to be proper and whatever. You can have your own personal vision about what you want as your person. If you're part of a company, you can, as a company say, okay, this is what we want. We want to be more inclusive. We want to hire more people with disabilities, want everybody interacting with each other, whatever it is your vision. We can help you come up with that. And then you want to have an assessment. You want to go have somebody come in to your company, to your church, to your organization and say, hey, okay, what is it that we are doing well? What is it that we're not doing so well? What do we need to do? And then we come up with a plan on how do you get to where you want to be. And that's why it starts with your vision. Then we come in and we assess. Then we come in and we write a plan. We talk about goals and how to get to where we want to get. And it's not, like we talked about, it's not going to happen overnight. It's not a simple checklist. It's like, how do you change not just the processes, the physical layout, the programs, but attitude. How do you change that attitude? And you do it slowly over time and you help people get there. So you plan on how you're going to make the changes. What are you going to do to get to the inclusive culture that we talked about? And now you want to execute your plan that you come up with. And of course, there's always going to be some changes in plans. That's just normal. But you want to say, this is where we're going and this is how we're going to get there. So, and ultimately, you want to get to the place of you having an inclusive culture in whatever your agency, church, business happens to be. Not just for, it's internal as far as you want all of your employees to be inclusive of each other and have all people with disabilities working along people without disabilities, but also for your customers as well. You want to make your customers feel welcome and belonging and just, you want them to feel comfortable with your business so that they will come back. You want repeat customers. And so one way to do that is having your customer service and whatever you're doing be completely inclusive and accessible in many different ways. And that accessibility comes in our assessments and in our planning and executing the plan. And now you want to continue with whatever you're doing, because it's not going to be, you know, let's say we make our goals and our plans. Well, okay, we got to reassess. We can reassess every 6 months, every year, whatever. But we come up with a plan, we execute it, we get to the point of inclusion, and then we want to make sure it stays there and doesn't backtrack, because it's very easy to backtrack once but once you're there a longer time, it's just nature. It's not as big of a deal. So this is kind of what we have next. And we, as inclusion education, we do provide all these services. So we'll come in and help you do a vision statement, help you assess what's going on, help you plan your goals, and then we'll work together on the process for you. And it does all begin with training. So this is the first step that you're taking to get your business where it needs to be, or your agency or yourself where it needs to be. So if you have any questions, any concerns, any ideas, you want to start that process of, okay, where do we go from here? Whatever it is, please email me, debbie.malone@inclusioneducation.com. Whatever it is that you think that you need. Now, one little quick thing. Okay, what do you say when you meet a person with a disability? I'll give you a second to think about that. Okay, so what is it that you say when you meet a person with a disability? What about hello? Just like you would anybody else. So my contact information, and I'd also like to know if you wouldn't mind, if you have concerns or questions or want to start the process and get some additional training, absolutely email me. But also email me with any suggestions you have about this training, additional trainings you may want, positives and negatives, so that I know what you need and I can meet your needs. And that's it. And thank you so much for attending and participating in our disability awareness and etiquette training.